In this presentation, we are going to first describe how our normal hearing system works. This will be followed by an explanation about how tinnitus develops when there is a disturbance in either of the major parts of our normal hearing system. This first diagram shows the ear with its three major divisions: the outer ear, also known as pinna or auricle, the middle ear, and the inner ear, which is also known as the cochlea. In this slide, we label the inner ear with its other name, cochlea. In order for us to hear, sound must make its way through the outer ear and middle ear to reach the inner ear or cochlea. The function of the cochlea is to convert sound to nerve impulses. It does this by stimulating the hearing nerve, which is shown in bright yellow in this diagram. The hearing nerve connects the inner ear to the brain at a place in the brainstem known as the first hearing center of the brain. The scientific name for this hearing center of the brain is the cochlear nucleus. This first hearing center of the brain has two sections. One is called the ventral cochlear nucleus, and the other has the name dorsal cochlear nucleus. If we only had the first hearing center of the brain, we could not hear. While the first hearing center of the brain is necessary for hearing, it is not sufficient for hearing. In order to hear, the activity from the first hearing center of the brain has to spread to the rest of the brain hearing centers, as is shown in this diagram. Surprisingly, there is a second part of our hearing system which is little known but is essential for our ability to tell where sounds are coming from. This second part of the hearing system originates from the muscles, tendons, and joints of our head and neck. Like the inner ear, the muscles, tendons, and joints of our head and neck stimulate nerves, which then go to the brain. Some of these nerves also stimulate the first hearing center of the brain. To summarize, we hear by the ear activating the hearing nerve, which then activates the brain, starting at the first hearing center of the brain. This first hearing center of the brain can also be activated by nerves coming from the muscles, tendons, and joints of our head and neck. Now, we consider how tinnitus develops. Probably the most common way tinnitus develops is when there is hearing loss. Hearing loss can come from any part of the ear. Dysfunction of the outer ear, middle ear, inner ear, or even the hearing nerve can cause hearing loss, which can then lead to tinnitus. The most common site of hearing loss is the inner ear, also known as the cochlea, as is shown in the diagram. When this occurs, it affects the rest of the hearing chain. Specifically, with hearing loss, the hearing nerve becomes underactive. But, paradoxically, the first hearing center of the brain reacts to this decreased activity by becoming overactive. To be more specific, it is only the dorsal cochlear nucleus section of the first hearing center of the brain that becomes overactive. This hyperactivity of the first hearing center of the brain then gets transmitted to the other hearing centers of the brain, which is then perceived as tinnitus. In a similar way, when the part of the hearing system that comes from the muscles, tendons, and joints of our head and neck dysfunctions, it also causes hyperactivity of the first hearing center of the brain, which gets transmitted to the other hearing centers of the brain, which is then perceived as tinnitus. We can summarize how tinnitus occurs as follows. If there is dysfunction in either of the two hearing systems, this can lead to overactivity of the first hearing center of the brain. This overactivity of the first hearing center of the brain is perceived by people as tinnitus. A corollary of this theory of tinnitus is the following. Not only can tinnitus occur from hearing loss alone, or from dysfunction of the muscles of the neck alone, but hearing loss and dysfunction of the muscles of the head and neck can combine to cause tinnitus when either one alone is not sufficient to cause tinnitus. In fact, some have suggested that the combination of the two may be the most common cause of tinnitus. We hope you've enjoyed our presentation. If you live in the Tel Aviv area and would like to receive treatment, or for more information about our staff, please visit us at www.tinnitushome.com. Thank you.